All right, so many of us are in the room virtually. Good afternoon. We're going to get started. Happy Lupus Awareness Month. I'm really excited to welcome you to our webinar tonight, Nutrition and Lupus, Fueling Your Body for Better Health, to kick off our month-long series of Lupus Awareness Month programming hosted by Hospital for Special Surgery. My name is Priscilla Calvache, and I'm the director of the Department of Social Work Programs at the Hospital for Special Surgery. The Department of Social Work Programs at HSS offers the most lupus support and education programs in the country. All of our programs are free and are available in English, Spanish, and Chinese. And for more information about our support programs, please view the link embedded in the chat box shortly. Before we get started, a few brief housekeeping items. Participants will be muted during the webinar. However, we highly encourage you to use the chat box to send in your questions throughout the session. Sue will address these questions after the presentation. We'll also be addressing questions that were submitted at registration. Lastly, we also value your feedback and would appreciate that if you could take a moment to complete our program evaluation survey. This link will be embedded in the chat box closer to the end of today's program, and we ask that you not leave us today without completing and sharing your feedback. Now it is my pleasure to introduce our speaker this afternoon. Sue Yu holds a Master of Science degree in Clinical Nutrition from New York University and is a certified diabetes care and education specialist. She also has a certificate in adult weight management training, is an active member of the Academy of Nutrition and Dietetics. Sue has worked with diverse patient populations throughout her career as a dietitian, gaining extensive experience in managing musculoskeletal diseases, autoimmune conditions, diabetes, gastrointestinal disorders, heart disease, and renal disease. Sue joined the Hospital for Special Surgery in 2006, where she has worked with patients dealing with spine, hip, knee, and shoulder disorders, as well as conditions like rheumatoid arthritis, scleroderma, lupus, and diabetes, primarily in inpatient settings. She currently serves as the chief outpatient dietitian at the hospital, and throughout her career, Sue has delivered numerous nutrition lectures on topics such as rheumatic diseases, bone health, aging, and diabetes. And today we have the pleasure of having Sue with us tonight to kick off our month-long series of programming. So please join me in giving a warm welcome to Sue Yu. Welcome, Sue.
Thank you so much, Priscilla, and thank you everybody for taking the time to join today's program. And I hope that by the end of this talk that you will understand the importance of nutrition related to lupus. Oh, okay. So just a little disclaimer here. The information provided in this presentation tonight is for educational purposes only and is not intended as medical advice. So always please talk to a healthcare provider before making any changes to your diet, exercise routine, or health regimen. So today, I'm going to be talking about the benefits of unsaturated fatty acids and what type of food you're going to get unsaturated fatty acids and why that is important in lupus. Vitamins and minerals, and again, like the food sources and why each vitamin that's going to be beneficial and why do we need them, all right? And most importantly, what not to eat with lupus. All right, so I'm going to have a full discussions on that as well. So just give a little nutrition overview. There is no specific lupus diet out there. So I just want to get a full disclosure out there. There's no specific lupus diet. However, eating a healthy, well-balanced diet can play a significant role in managing lupus. Eating foods rich in anti-inflammatory, antioxidants, omega-3 fatty acids, and vitamins are vital to manage the disease. So I'm going to go each category and why each food is important and how you can incorporate them into your diet regularly. So let's just take a look at anti-inflammatory fruits and vegetables. There's no greater way of getting anti-inflammatory properties than through our food. So what are the anti-inflammatory fruits? All berries are excellent source for anti-inflammatory, such as blueberries, strawberries, raspberries, blackberries. All right, they're all fantastic. And some of the berries, especially blueberries, they don't just contain anti-inflammatory properties, but they also contain antioxidants as well too. So I'm going to go a little bit later on about antioxidants and why they are important. And then all citrus fruits, right? Citrus fruits such as oranges, tangerines, clementines, lemons, limes, and grapefruits are also very important part of anti-inflammatory. And then your vegetables such as spinach, kale, all the leafy greens, right? Spinach, kale, collard greens, bok choy, switch chaw, mustard green, broccoli, and carrots. And one of the highest anti-inflammatory properties that certain food contains are our herbs and spices. If you're able to tolerate herbs and spices, I highly recommend for you to incorporate them in your cooking, in marinating your food, or even doing takeouts. If you, for instance, if you buy takeout, there's nothing wrong with bringing a container of food home and adding this list of herbs and spices onto your food. So what are those herbs and spices really? They are your turmeric, cumin, ginger, cinnamon, red chili pepper or black pepper, basil, parsley, fennel seeds, anise, rosemary, thyme, and cilantro. And if you're able to add them in any of those herbs and spices regularly, either through salad dressing that you can incorporate them into it. Again, you can use herbs and spices to marinate any type of protein food that you're cooking. Either it could be a piece of chicken, a piece of fish, or soups that you're making, any type of soups, especially lentils or any type of bean soup. It is wonderful to add these herbs and spices to your dish. Now, these herbs and spices, they come both fresh and dried. It doesn't matter the form of herbs and spices you're getting. It can be fresh or dried. A matter of fact, a lot of time I highly recommend dried version of it because the dry herbs and spices last a long time in your kitchen cabinet versus the fresh herbs and spices can rotten quite quickly if you don't use them right away. Mm. So let's just talk about the unsaturated fatty acids and why they are important for us. So research have shown that a diet rich in unsaturated fatty acids provides a positive response in patients with lupus as well as rheumatoid arthritis. So what are the component, what make up omega-3 fatty acids? So omega-3 fatty acids contains two things. They're called EPA and DHA. And what they do is they provide an anti-inflammatory effect by decreasing C-reactive protein. That's the CRP on your blood work. So it has the ability to lower inflammation that way. So it's not just helping lowering the CRP level in your blood, but it also helps to lower total cholesterol as well, especially the bad cholesterol, which is the LDL, as well as the triglyceride levels. And also, it protects against free radicals, an important factor for heart health. So free radicals is can be very damaging to our blood vessels and our heart. So having the unsaturated fatty acids from our diet will give that protective mechanism for our cardiovascular health. It is recommended in order to have an anti-inflammatory effect that one needs to consume 2 grams of unsaturated fatty acids per day. So what are the food sources of omega-3 fatty acids? Again, I prefer you guys out there to, as much as possible, try to get every nutrient that I'm speaking about tonight to get it through food first. By all means, do your best to obtain all these nutrients through food first before supplements. So the food sources of omega-3 fatty acids are olive oil. So you can use olive oil for cooking. In salad dressing is wonderful. Chia seeds. You can add chia seeds to oatmeal or to smoothie. It is a wonderful source for omega-3 fatty acids. Flax seeds or flaxseed oil, walnuts, and eating high fatty fish such as salmon, tuna, cod, sardine, herring, and mackerel. Now, some of the fish I haven't listed here is because they don't contain as much omega-3 fatty acids as those fish being listed here. So if you're eating all the fish, you're still getting some omega-3 fatty acids. The content is just not as high. Sometimes just having a serving of this fish, let's say, for example, one serving could be 4 ounces of salmon. Just having 4 ounces of salmon a day, you will obtain enough omega-3 fatty acids to meet that requirement to have the beneficial effects of having the anti-inflammatory, which help to decrease inflammation in your body. So let's just take a look at flaxseed oil. I want to put an emphasis on here is because flaxseed oil contains 70% concentration in omega-3. So it is a wonderful oil, and most of the time we use flaxseed oil in salad dressing. So you can definitely, in addition to using olive oil, you might choose also to have in your kitchen cabinet flaxseed oil in there, right? Again, because it's just have such a high concentration of omega-3 fatty acids. 70% is quite high. And it showed that intake of 30 grams, which is equivalent to 5 teaspoons of the flaxseed oil a day can help patients with renal dysfunction. All right. So especially folks who have lupus nephritis, where your own body attacks the kidneys, taking flaxseed oil might be beneficial for that effect. And let's go into the vitamins. All right, so vitamin A. Vitamin A is a very important vitamin for our eye health. It has an antioxidant property. What is antioxidant anyway? Antioxidant is a type of vitamins that actually helps to protect the good cells in our body from damaging, from getting damaged from free radicals that's floating around in our bodies, or sometimes from certain food that we eat that is a byproduct that can be also damaging to our cells. So antioxidants is, instead of attacking those free radicals, attacking the good cells, the antioxidant, the vitamins, for example, vitamin A, the vitamin A will destroy its cells in order to protect the cell. All right. So it is a very important vitamin for that reason. All right. But with vitamin A, even though it's antioxidant property, it's good for our eye health, it is not good to take more than 3,000 microgram, which is equivalent to 10,000 IU a day, unless it's directed by your doctor. There might be a reason why you need that extra vitamin A, but excessive intake can lead to causing dry skin, for example, alopecia, which is hair loss, um, headache, nausea, anemia, liver damage, and death. Death is usually related to liver damage if excessive vitamin A is taken by supplement. So, what are the food sources of vitamin A? Uh, Think of your orange color food. Your orange color food is loaded with vitamin A. There are your carrots, pumpkins, sweet potatoes, cantaloupe, broccoli, liver, and fish. There's very good source of it. And when you get vitamin A from food, there's no danger in overdoing it. There's no danger of excessive intake. You will not be having any liver damage by eating a pound of carrots a day, for instance. So there is that very safe mechanism when you're taking obtaining nutrients from food sources. Mm. So vitamin C, very similar to vitamin A, it also has a very important antioxidant property. Again, antioxidants are helping protecting the good cells in our body from getting damaged, right? So all those free radicals sometimes will damage the vitamin C and then help to protect the good cells. But it also helps to reduce inflammation. Studies have shown that supplementations of 1,000 milligram of vitamin C a day in lupus patients shown to be beneficial, which means shown to reduce inflammation. A combination of 500 milligram of vitamin C along with 800 IU of vitamin E a day have a protective effect on cardiovascular health. So this one particular study did look at patients are taking supplementation of 500 milligram of vitamin C along with 800 IU of vitamin E a day, and they have this cardiovascular protectiveness. So what are the food sources of vitamin C? Vitamin C's are found widely in all citrus fruits. All right, so all citrus fruits, there are your oranges, your tangerines, right? Your grapefruits, your limes, lemons, they all contains very, very good source for vitamin C. And then your dark green leafy vegetables, such as kale, collard greens, mustard greens, spinach. Eat them up because they have so much nutrients in them. Broccoli, green peppers, strawberries, guava, and kiwi fruits. By the way, they're saying that one little kiwi fruit a day actually has enough vitamin C in them for the day's requirement. So having one little kiwi fruit a day is not a bad thing to do if you like to eat them. So vitamin D. Vitamin D is an important vitamin in bone health. It is what I call it. Vitamin D is calcium's little helper because we need vitamin D in order for calcium to get into bones. All right. And vitamin D is the only vitamin that our body can make independent of our diet. All right, so we do have the ability to make vitamin D with sun exposure. However, due to the risk for skin cancer, there's no much recommendation in terms of going out there and getting sun exposure. So I don't generally recommend people to freely go out and expose themselves to sunlight for extended period of time, because that definitely causes more harm than good. So recommendation for vitamin D is for both men and women is the same. Anyone who is 70 years or younger should get about 600 IU a day, and anyone who is over the age of 70 years old should get about 800 IU a day. So you might say, well, Sue, how come if that is the recommendation, how come my doctor tells me to take a lot higher vitamin D intake per day? So usually vitamin D recommendation is based on your own blood work results. So if you have a very, very low number, your requirement for vitamin D intake can be significantly higher than the daily recommendation. All right, so don't be too concerning if your own vitamin D need is a lot higher than 800 IU per day, for instance. All right, because it does take a long while for the vitamin D level to go up to a normal range. So sometimes taking a higher intake is definitely warranted. So food sources of vitamin D are only occur in very, very few food, unfortunately. So, and they are your fortified dairy products, all right, such as milk, cheese, yogurt. Liver has vitamin D naturally. Egg yolks also contain vitamin D naturally as well too. And then your oily fish such as salmon, sardine, mackerel, cod also contain some vitamin D form. Because vitamin D comes in very little food, oftentimes, this is the only vitamin I would say that most of the time we do need supplementation. All right, this is the only vitamin that we absolutely oftentimes need supplementation versus other vitamins like vitamin A, vitamin C. We're able to get enough of it from food. All right, so vitamin D is one of those that we just need supplementation. So let's talk about vitamin E. Vitamin E, just like A and C, is an antioxidant vitamin. So it helps to protect our cells, but it also helps to decrease inflammation, especially if you are eating a vitamin E containing food along with omega-3 fatty acid food. So very good concentration of vitamin E food or almonds, for instance, sunflower seeds, hazelnuts, and avocado. Okay, so I highly recommend for your folks to incorporate like the almonds, the sunflower seeds, the hazelnuts, and the avocado to your diet. So calcium. As we age, we are at risk of getting osteoporosis, either from having family history of having osteoporosis, and it could be medications, especially for folks with lupus, with the condition itself. Sometimes you might need medications that contain steroid in it, and unfortunately, those medications that contain steroids or steroid like prednisone, for instance, by themselves, that having a long-term intake of those medication can increase your risk for osteoporosis because those medication decreases calcium absorption. And also too, oftentimes we just not eating enough calcium in our diet. That can also be the leading factor of having osteoporosis. So one of the recommendation for calcium intake, it is different between men and women. So women need a little bit more calcium than men from an earlier age on. So for instance, for women who is less than 50 years old, we do need about 1,000 milligram a day, and anyone who is above 50 years old will need 1,200 milligram a day. And for men, anyone who's between the ages of 50 and 70, the recommendation is 1,000 milligram a day. And for a man, you would have to be over the age of 70 years old um, to to need 1,200 milligram a day. All right, so women do tend to need a lot more calcium at an earlier age as compared to men. So, what are the food sources of calcium? Your dairy products is number one, naturally contains a lot of calcium. Your dairy products can be milk, cheese, or yogurt. Just to give you an example of how much calcium it is in a cup of milk, 1 cup of milk, that's 8 ounces, contains 300 milligram of calcium. All right, so just drinking a cup of milk, you're already meeting a quarter of your calcium need for the day. And eating dark green leafy vegetables are wonderful. So remember earlier about dark green leafy vegetable also contains vitamin C, right? High concentration of vitamin C, and some of them also has vitamin A as well too. And then your fortified nut milk. So any folks who are lactose intolerant, that cannot tolerate cow's milk, there are a lot of different alternative milk out there. So you can have fortified almond milk, soy milk, cashew milk, rice milk, coconut milk. So they have many options out there for us to have besides having cow's milk. And then you canned sardines with bones. I have to specify here, it has to be with bones because if you buy sardines that are boneless and skinless, you're not going to get the benefit of having calcium. So calcium are stored in bones. So whether it's animals or humans. So in animals like fish, for instance, so the calcium, you will find it inside the bones. So because it's canned sardines, the bones are very soft, you can't eat them. And then almonds. Almonds, edamame, and tofu are such a wonderful sort of vegetarian option of getting enough calcium from the diet. If your folks out there who likes to eat tofu and doesn't mind to have tofu in your diet, I do recommend the hard tofu versus the soft one. The hard tofu, the firm tofu contains more calcium than the soft or silky version. So they do have different consistency of tofu. So please, if the firmer the tofu, the more calcium you're going to get. Okay, so let's go to foods not to eat, right? Foods are actually going to be very harmful, that's going to hurt lupus. Wet meat. All right, high intake of wet meat. So what are the wet meats? That's your beef, your lamb, and your duck. So those are the 3 red meat category because they're very high in saturated fat. And the saturated fat actually contribute to inflammation. So in terms of wet meats, eating it once a week, maybe once every 2 weeks even, will be okay. But please do not have red meats on a daily basis or, cut back on frequency would definitely help. And any processed foods, right? Processed foods are high in salt. They usually contain very unhealthy fats, such as like saturated fat or worse is trans fat. And they also have additives that can worsen inflammation. So any processed food meaning foods that all come in ready to eat packages. All right, that's all your cookies, your crackers out there, right? Your frozen TV dinners, all the junk food, the chips, those are not healthy food to be eaten. And again, they can cause inflammation. So saturated fat and trans fats are found in many different fried food and also found in many fast food restaurants as well too. So I want you to think twice about ordering a hamburger with French fries. Oftentimes they do contain some sort of saturated fat or trans fat in those food. Again, any processed snacks. So any chips of any form could be potato chips or nacho chips that made from wheat flour or corn flour. They're no better. They're not healthy and they are causing inflammation. And excessive sugar intake. Sugar, by the way, is the number one food in our diet that causes inflammation. So, and it doesn't just cause inflammation by eating high sugar amounts, but also cause us to gain weight very easily as well. So sugar is definitely one of the area I would highly recommend for everybody, not just persons with lupus, but also individual, just being helpful, everyday health wise, to please lower the sugar intake. Right. And salt, sodium. Salt is another having a bad effect on our health because sodium increases renal dysfunction, especially for folks who have lupus nephritis. All right, and also increases blood pressure. So there's really no good in eating a lot of salt. So the recommendation for salt intake is really only 2,300 milligram a day. And 2,300 milligram a day, that is equivalent to saying 1 teaspoon. So 1 teaspoon divided into 3 meals for breakfast, lunch, and dinner is not a lot of salt. So please do be mindful of your sodium content of your food. If you're ever buying package or food products, please do pay attention to the food label, the nutrition facts label to look for sodium content. All right. If a product, for instance, especially those frozen TV dinners, it says one package already has like 1,200 milligram of salt in that one particular package. Guess what? It is an extremely high sodium content meal there. So when you cook at home, try to use more herbs and spices to flavor your food so the need for salt intake will be less. All right, and will be a lot healthier for you. As we know, all the herbs and spices contain an anti-inflammatory properties. And this is very important for my lupus friends out there. Please remember not to eat alfalfa sprouts and garlic. Unfortunately, alfalfa sprouts and garlic both can exacerbate your immune system and can increase lupus flare-ups. All right. So instead, alfalfa sprouts generally people like to use to add to their salads, right? I would say use other form of sprouts. If you like to eat sprouts, do not eat alfalfa sprouts. You can have other sprouts, other bean sprouts. They actually now, many supermarkets sell microgreens that has like baby greens or broccoli or kale. Those will be fine for you to eat. And garlic, I know garlic are found in many, many, many different dishes, especially if you eating out frequently. A lot of restaurants do prepare their dish with some form of garlic ingredient in there. So when you do go out to eat, please tell them that you're allergic to garlic. I say, please do not use garlic in my cooking. I am allergic to it. That's how they will pay more attention to it. And so make sure that they don't cook garlic in your dish. Regard substitutions when you're cooking at home, great substitutions to use instead of garlic or onions, for example. Onions is wonderful. Shallots are wonderful to use in cooking, as well as scallions, especially the right part of the scallion. You can chop it up and you can use it in cooking, and it provides just as flavorful as a garlic would do to your dish. So feel free to use your onions in cooking instead of garlic. Mm. So my takeaway is please get your nutrients from food first whenever possible. If you're able to eat those foods that I just discussed earlier, try to incorporate them. You don't have to eat every single of those food every single day. Have a rotation of them because there's no one food out there that contains all the necessary nutrients that our body needs. So it's always good to have a variety of food in our diet. Don't stick to just eating one or two kind of food every day. Try to explore your world by incorporating more different food, different fruits and vegetables. All right. The big takeaway is also intake of omega-3 fatty acids has a very strong correlations for benefits, overall health, as well as for lupus patients. Right? And eating a well-balanced diet, when I say well-balanced, meaning that on your plate, you're going to have a nice servings of vegetables and a piece of lean protein and a small portion of whole grains. All right, that whole grain can be a whole piece of bread, can be brown rice, can be whole wheat pasta, can be quinoa. So that is a well-balanced intake, right? When you're having food from different food groups on your plate. And eating more plant-based foods, such as those fruits and vegetables I mentioned earlier, in addition to having the nuts and the seeds and the fish, are highly beneficial. And then again, avoid foods that are known to cause flare-ups, all right? For lupus friends out there, please avoid alfalfa sprouts and garlic. All right, avoid those two things that are known to cause flare-ups. And then obviously, I think the most important thing also to avoid is those processed foods that I mentioned earlier. All right, so high intake of sugar is not recommended. So sugar is not just coming from the cakes with muffins and donuts in our diet, but also can be in the form of drinks, beverages, all right, sodas, sweetened iced teas, even juices, fruit juices is not healthy at all because they have very high concentration of sugar and that can cause inflammation. All right. There is, I have to say, a very misleading information about drinking fruit juices. A lot of people thinking that, well, if I'm drinking organic 100% fruit juice, that will be healthy for me to do. That's not the case. All right. It is still sugar in liquid form, and unfortunately that can increase inflammation. So I prefer you to eat a whole fruit. Having a whole orange is very different. Your body's response is very different than drinking a cup of orange juice. All right. So please eat your whole fruit and not the juice. All right, so I will hand it over to Priscilla if we have any questions, concerns folks might have.
Thank you so much, Sue. You can stop sharing screen now if you'd like. Thank you again, really, for that comprehensive and excellent presentation. Really, a lot of great, valuable information on managing nutrition while living with lupus. So, at this time, we're going to transition to the question and answer portion of the program. I see lots of questions coming into the chat box. We have plenty of time to address most of these questions. I was going to begin with some of the registration questions, but I think one of the hot topics in the chat box currently is, can you talk more about why we should be avoiding garlic as lupus patients? Is this newer research that has come out that shows evidence that lupus patients, that it's not good in terms of causing flares? We seem to have a lot of patients who are surprised by hearing this.
Yeah, so garlic, there is a component in garlic. It's called allicin. There's a compound in garlic that unfortunately can cause flare up. It's sort of like activate in a normal circumstances of a patient without lupus. Garlic actually is a great sort of like protecting our immune system. But however, because of lupus is an autoimmune disease, you just heighten up your immune system, and that can have a high chances of getting flare-ups. So it's almost like you are providing fuel to the immune system, sort of like overacting it. So that unfortunately can cause flare-ups in lupus. So it's really the chemical compound in garlic and in alfalfa sprouts that causes this reaction.
Now, is it any type of garlic? Is it powdered garlic? Do you see the same reaction? So if somebody were to sprinkle some garlic on a slice of pizza or something, for example, is it the amount of that you're intaking, or is it just avoiding it at all costs? We have questions coming in about
Yeah, I would say avoid at all costs. So it doesn't matter whether it's fresh garlic or dry garlic in powder or those dry diced garlic, it's going to have the same immune response. So I would advise to avoid at all costs if possible.
I see some patients commenting that garlic seemed to be an issue before they were diagnosed with lupus, but this was something that was new to many here who are attending. So we're going to go into some of the earlier questions that was received in the chat box. So I'm just going to make sure I'm scanning so I didn't miss anything. Um, all right. So what are some nutritional supplements that are good for lupus patients?
I would say probably might be like the vitamin C, like the 500 milligram of vitamin C and the 800 IU of vitamin E together have shown to decrease inflammation in lupus patients. So that could be like just like food for thought type of things to keep that in the back of your head. But again, like we can actually have a good amount of vitamin C in our diet if we include like citrus fruits, leafy greens, like the kiwi fruits that I mentioned earlier. That could be a really nice to have. But overall, I don't think if anyone specifically need to take a supplement because they have lupus, unless it's vitamin D. Vitamin D is the only vitamin supplementation out there that we might need that in supplementation.
Thank you so much, Sue. We also had some questions regarding patients who are living with lupus nephritis. What specific diet should they follow, and should it be geared towards kidney-friendly foods like low potassium and protein foods?
It all depends on the different stages of kidney damage. So lupus nephritis, it also associate with the stages of kidney function. So in the early stage, you might not need to restrict anything. It's just a really close monitoring. Again, like decreased salt intake is definitely the number one recommendation out there. At a little advanced kidney function, in advanced stage, they might need to restrict the potassium intake, as well as obviously the sodium, but also protein too. So for certain folks, they might need to restrict protein depending again on their renal function tests. Mhm.
Thank you, Sue. Someone's asking about savory applications for chia and flax seeds, and if there's any evidence that high lectin foods can cause gut or systemic inflammation.
No. A matter of fact, incorporating this is I know there's a lot of hot topics out there about like lectins that found in like beans and certain nuts and seeds that all could be damaging. The answer is absolutely not. A matter of fact, incorporating the nuts and the seeds in your diet actually help to lower inflammation. So there are more and more research out there about, intake of those food like the beans and the lentils, the nuts and the seeds actually improved inflammation significantly. And they can actually show by having tests, like testing the CRP level of those patients.
There's a follow-up question to that about can using seed oils like sunflower seed or avocado oil in cooking be a good way to get the antioxidants, as you were mentioning?
Oh, absolutely. That is a wonderful alternative. So if you cannot tolerate any whole seeds, by all means, use the seed oils in cooking. That's absolutely a wonderful way to obtain it. And even nuts, right? If you're not able to tolerate whole nut, like a whole almond, for instance, there are almond butter that you can eat and incorporate into your diet. So yes, it's absolutely, you can do that.
Thank you, Sue. And any guidance around lupus patients who are in perimenopause or menopause? Any nutritional guidance that's important for those specific patients?
Yeah, so unfortunately, there's few things when women are going into perimenopause and menopause is that there is a decrease in hormonal functions. And unfortunately, once your hormone function start to lowering, and they're saying that lowering 10 years before we actually going into menopause. So within that time, focus on eating enough calcium food. Make sure when you go into your annual physical exam, ask your doctor to check your vitamin D level. You might need to take a vitamin D supplement just to make sure that you are staying on top of your bone health. Because we all have, as women, we all are increased risk for developing osteoporosis because of this peri and postmenopausal phase that we have to go through. So please, so calcium and vitamin D is very important, and also weight control. Unfortunately, when hormone levels are lowering, there is a chance for weight gain, right? So because that also affects our metabolism. So our metabolism being slowed down, therefore weight gain tend to be an issue as well. So staying active, exercise as often as you can. The recommendation in terms of exercise is 30 minutes a day, 5 times a week. So if you're able to incorporate that, any form of exercise is wonderful to do as long as you like doing them. All right. And that 30 minutes a day doesn't have to be in one interval. You can divide it into multiple intervals per day. However, it can incorporate into your lifestyle and your schedule.
So speaking about that, Sue, as you know, lupus fatigue is a very real component of many of the symptoms that patients with lupus are living with. Do you have any tips for how to eat healthy when lacking the energy to prep or even cook meals and trying to get all of the good fruits and just some of the great nutrients? As you said, it's better when it's coming from the food. But if you're feeling or struggling with fatigue, any tips on how to be able to optimize nutrition?
Yeah, sometimes I find like small frequent meals might be beneficial rather than having your typical eating breakfast, lunch, and dinner. A meal doesn't have to be sitting down, have a plate of food, right? It can be a healthy snack. A healthy snack can be, is part of your meal, could be having an apple with some almond butter in. So especially who are like somebody who's struggling with fatigue often, I find that those folks are oftentimes not eating enough protein food. So meanwhile, you lack of fatigue, so that will also decrease your sort of desire to exercise, right? And when you don't move much and you are not eating much, you're gonna be losing a lot of lean muscle mass. And losing lean muscle mass also leads to feeling of fatigue. This vicious cycle just keep going on, right? So I think having like really simple available snack food could be dry nuts like having almonds, peanuts, what that contains protein. Any of the nut butter is wonderful. Having yogurt, cottage cheese, or any form of cheese that you like, having that as a snack or adding to your meals, like you can have like frozen vegetables and pop in the microwave, heat it up, and add a slice of cheese on top of, like, let's say, for example, a frozen broccoli that you just heat it up in the microwave and you're adding a slice of cheese in it. That provides a lot of nutrients. All right. So certain frozen food is actually healthy, such as frozen vegetables, frozen any type of frozen berries or frozen fruits is a wonderful alternative to fresh. And they are just as healthy for us as compared to eating fresh.
Thank you, Sue. That was really helpful. Now, there's several who are asking in the chat box about just alternatives for sugar. Any kind of guidance on that? Is stevia, monk fruit, any other alternatives that are better for us in terms of sugar?
Yeah, so monk fruit sugar and stevia are more natural form of alternative sugar. They're made from stevia plants, and then obviously monk fruit is a fruit, those sugar being extracted from it. But unfortunately, they all research have shown that excessive intake, even from those more natural sugar, there's still risk of blood clots if you eat too much of them. So is there like a healthier alternative? Probably, in my opinion, not,
Mhm.
because they seem to be all having some kind of side effects. There are more and more research of finding right now. So it's not necessarily healthy to be eating a lot of stevia or monk fruits. But let's say if you're having a morning cup of coffee and you just want to have a pack of stevia, having one pack a day probably is not going to do a lot of damage at all, or doesn't probably won't do anything at all. So that would be okay. But when you start to add up, and I know some folks would want to have like 5, 6 packets of stevia a day, or in addition, they're not just using it in their beverages, but they also use it in baking and cooking. So those intake can add up. And again, like current research has shown that excessive intake can lead to blood clots, which is a very serious thing.
Thank you. So we had several questions come in about specifically turmeric supplements. We have someone who says that they were on it. It did, seem like it was offering a lot of benefits, and then they broke into a rash and had to stop. Do you have any guidance on turmeric supplements or just turmeric use in general?
Yeah, so that's the thing with those supplementation is it's not regulated. So you never know, even though they claim that it's turmeric, but you don't know what kind of additives they added to it. So it might be an ingredient in that turmeric supplementation that is not agreeable. I would suggest just go with using turmeric in your like natural turmeric. Buying turmeric powder, what they do sell fresh turmeric in certain supermarkets too. Add them to your meal. Let's say if you're making a chicken dish, there's nothing wrong with sprinkle a little bit of turmeric in marinating that piece of chicken before you cook it, or sprinkle it onto your food when you're ready to eat. Or especially in soups, I find that adding a little turmeric when you making soup is also really nice too. It's just a healthy way to incorporate. So I would prefer the actual spice and not supplementation.
Thank you, Sue. So, just as we wrap up, just quite some comments around any specific diets. We've had patients share that they've benefited from Mediterranean diets, plant-based diets. Someone saying that they were recommended the paleo diet and they found it very helpful, which includes a lot of grass-fed beef. Is there a difference in opinion on that? Any comment on the specific type of diets for lupus patients?
There is a lot of research out there for in terms like relations to lupus is Mediterranean diet. So eating a Mediterranean diet does help to lower inflammation. And so therefore it is highly recommended as a result because that's one of the diet out there that's highly researched is a Mediterranean diet. So that's why a lot of doctors are recommending patients to eat because there's a lot of research to support that. So in terms of like a plant diet, either eating a vegetarian diet or more plant forward eating, that does also show a huge benefit in there. But as with any of the diet, it's very, very individualized. You might be responding very differently than my body would be responding to it. Unfortunately, it is trial and error. Like, there's nothing wrong with trying out certain diet to see if that fits for you and whether your body will be responding positively to it. It's just by trying it out. Again, like there's no one diet that is perfect for everybody. It's not one size fits all.
Thank you, Sue. Some are just asking, just to go back to the turmeric, any substitutions for turmeric? Some are saying curcumin is the main active ingredient in turmeric, or do you have any other suggestions there?
A supplementation in terms of turmeric, you can go with instead of eating turmeric or taking a turmeric supplement, you can adding like black pepper, for example. Turmeric actually goes well with black pepper. If you just having turmeric by itself, it's actually not as effective as if you're adding black pepper to it together. So they sort of like help each other out. They sort of activate each other. So it produce more anti-inflammatory properties. But they'll have a long list of spices that you can eat instead of turmeric. So black pepper, red chili pepper. Then you have ginger. That's wonderful as well too. So it doesn't have to be turmeric if turmeric is something that you cannot tolerate because it is a spice, so which means it contains a little heat. So anyone who has like a gastric reflux disease might not be able to tolerate that well. If that's the case, also to move over to the herbs. Herbs are generally speaking a lot gentler on our stomach. So having something like basils, thymes, right? The cilantros, the rosemary, those are more gentler on our digestive system. And oftentimes people can tolerate that. So you can actually focus on just incorporating the herbs in your diet instead of the spices.
Thank you so much, Sue, for spending this hour with us. I can certainly agree that we've learned so much from you this evening.